Hello everyone, this is Jennifer. I have closed from my job and I had some things I wanted to talk about. I wanted to just express them. There were thoughts in my mind I wanted to express. Could be the hormone talking, but just hear me out right now. So for healthcare, I know, be it a doctor, be it a nurse, be it whatever service you do in healthcare, you do it not for the money. And having said that, I also am aware that we are being paid too, because of course we have to live and we have bills, and that's normal life. But my thought was, I'm starting all the way from the bottom. I'm a housekeeper right now. I'm going all the way to the top. I don't see the future. I can see the future. I can see tomorrow. But I can only plan and put in the work for my future to be bright. I can only put in the effort and put in the work, like I said, for my future to be successful. And that is what I'm trying to do. I have 24 hours. And sometimes I do more than 5 things a day to 7 things. Sometimes I don't even count how many things I do in a day, just to keep going, just to keep my household going, just to keep myself going, just to prioritize things. I burn the midnight oil. I have sleepless nights at time. I do put things in their perspective in order for things to be actualized. And if you look it that way, as I am looking at it, and feel this is logical what I'm saying, as I know it is logical what I'm saying right now, is having gone all the way from the bottom and God actualizes it, which I know He will, because I'm putting in the work, to the final point that I become a registered nurse. One day I become a doctor, but let's put it as a registered nurse because it's step by step. I become a registered nurse one day, and being a housekeeper with a housekeeping experience, somebody wakes up one day and say, "Hey Jennifer, I would like you to do a work of a housekeeper and a work of a nurse at the same time." While I have patients in there, while I have more than one patient calling for my attention, when I have to give medication, chat, put in catheter, do all the stuff, and have to attend to my patients. Good gracious Lord. Even if I know the number one priority is the patient, the number one priority is the patient, it would not be nice, and would not like the devil to use me or the devil to use someone else to economize, to cut down costs, when the housekeeper can be given the job to do and create a job for the housekeeper. It would not be nice for someone to give me the job of a housekeeper and give me a job of a nurse at the same time. I just feel it would not be nice after doing all of that, going schooling, after doing all the bonding of the midnight oil, after doing all the stress and stress of my mental health, my brain working simultaneously to make sure I have to do things and actualize them. It would not be nice for someone to give me a work of a housekeeper and then a work of a nurse, or a work of a doctor and a work of a housekeeper at the same time. It wouldn't be nice. I'm just saying this out, as these are thoughts that I have been thinking about. And if I did check somewhere online, I checked online, and please guys, put a comment below if I am saying the price range that you're being paid as a registered nurse or new graduate nurse. I see that some people have been paid over $40, some all the way to $47, and I see some price range from $35 to $47 per hour. So let me know what your price range is at there. Now, if you would try to say, "Hey, I want you to be a housekeeper and do the work of a housekeeper, and I want you to be a nurse at the same time," I wouldn't mind getting a $60 per hour money. or a $50 per hour money doing both jobs at the same time. Yes, as a nurse, I know I'm supposed to do certain things to keep my patient comfortable, but I would not be having to do a housekeeping job. It would not be nice for someone to do that. You taking the job from housekeeper and you putting strain and stress on people, and putting strain and stress on the patients as well that need to be attended to at that point in time. So, and I say this again, whatever job we do, be it a housekeeper, be it a nurse, be it a doctor, be it whatever job we do in the hospital, all these jobs are done not for the money. Because if you were to quantify with money, money cannot pay some of the outrageous things we have to face, and money cannot also pay the love and effort and the sacrifice we put in for a particular patient, to see that that particular patient makes it out of there, or that particular patient doesn't continue suffering like that, or that particular patient is well taken care of. Money cannot quantify it totally for some things we do in the healthcare. And having said that, I'm not trying to take this on myself, but maybe it's the hormone speaking, but joke apart, I'm just having to say this out there, that it's not something that I would feel it's nice to do. I mean, and like I say, don't use the devil. Don't make the devil use you or use me. Because if you were to say, hey, okay, let's give this one a housekeeping job and let's give you a nursing job at the same time, guess what? Just put the money together, increase it. Knock on my door with $50 to $60 per hour. I'll be fine. But for we not to let the devil to use each other, it to be appropriate to give the housekeepers their job, the nurses their job, so that we have boundaries and we know what it is that is required. And in that system, you create jobs, and in that system, things keep running as the way they are supposed to run. And having said that, what do I know? I don't know nothing, but I'm just having to try to make sure that my future is successful, and I'm also trying to make sure that that 24 hours that God has given to me, I utilize it, because time waits for nobody. I've seen it. Time waits for nobody. And bear with me with this my long thought right now. But having said that, it's just a thought I was thinking. And let me know what price range you've been paid there. Feel free, and please let your comments be politeful one. I want to hear your honest thoughts, but make it politeful. I am who I am. I don't try to be who I am not. I do everything in an authentic way. I put myself in the shoes of others to try to understand what it is they experience, and I have been in the shoes of others to experience that as well. But I am not a lawyer. I'm not an advocate for anybody out there. I'm just Jennifer. I'm just saying my thoughts right now, and this video may please not be used in the future for anything to cause me problems, because this is just a video, or cause problem for somebody, because this is just a video that I'm making just to express my thoughts, and hear me out, because some of the things I know I said are very logical and they are meaningful. So put in your comment if you feel like you want to do that. I would highly appreciate that. And my final grade for my sociology came out. I am sorry, I was supposed to say put that in yesterday. It came out already and I passed. And my school is the St. Louis Community College. I still love my school. Dr. Wagner, thank you for putting up my grade. Dr. Divine, thank you, Doc. What else do I have in my mind right now? Keep pushing. Dream. Put the work towards the dream, and you will actualize it. I'll try my best. I don't see the future. God does. But I have to put in the work to see the future come to pass. Even as Christians, we I'll know that faith without work is dead. Dead, I mean. I can dream of it and I don't walk toward it. I will not actualize it. And that is what I'm trying to do. Walk towards all the dreams I have so that one day it comes to pass. And this is Jennifer. This is just me. And having said that, thank you, my school, St. Louis Community College. I still love you guys. I'm still going to that school, and look forward to me graduating. And with that being said, this is August the 6th, 2025, a Wednesday. I want to say have a good evening. Sleep tight. Bye bye.